My name is John Ferrell. I'm one of the founders and managing partner of Regenerative Orthopedics and Sports Medicine. So we're here today to do a procedure on a VIP patient. Not only is he very important, but this stands for Veterans in Pain. So this is a wonderful group out there that is finding providers and hooking them up with veterans that are in pain and they don't have other great treatment options. So as a former Navy vet myself, I know, the importance of having people that are fighting for our country and taking care of our country, and we want to be there to help to support them, to help to support the community. So we love being a part of the VIP group. Today we have a gentleman that's dealing with chronic shoulder pain. He didn't have many other options besides a shoulder replacement. So he's looking to us to see if we can do some things to kind of help out. And so we decided that looking at his MRI and his physical exam that we were going to move forward with a procedure called micro-fragmented adipose tissue. So this is where we actually take fat from his hips or his abdomen and put into the area where he has pain. We were fortunate enough that the VIP program got Lipogems, which is a group that makes a kit, an FDA-approved kit, to get fat out and use it for chronic pain. They're going to donate the kit for us so we can do this treatment at no cost for the patient. This is going to be where we take the microfragmented adipose tissue. We're going to take fat out, we're going to put it into the shoulder joint, and we're going to treat the areas that are causing the pain. Our goals with this are to increase his range of motion, to improve his strength, and to allow him to get back to doing his normal daily activities so he can take care of his family properly. This is a procedure that we've been using for the last 7 years or so with excellent results and excellent benefit. This has level 1 evidence for its use. And it has over 100 peer-reviewed studies for use in pain in different musculoskeletal areas.
Hi, I'm Bill Haupt. I'm a U.S. Army veteran. Been suffering for pain for quite a while. Went to a doctor and he said I need a complete shoulder replacement. I didn't know what that was. He didn't tell me what it was. So I went home and researched it and found all these ugly stories online. So I searched out a second opinion. Found another orthopedic doctor said, yes, you need a shoulder replacement. No, don't do it because you're way too young. It's radical surgery. So the insurance company sent me to another doctor for a second opinion. We agreed with my second doctor said, yes, you need a shoulder replacement. Don't do it because the first doctor said, yes, let's do it. And he said, the doctor just wants the money. Don't do it. So I was kind of like stuck in limbo. I was like, what do I do? I'm in all so much pain. And just came across the VIP program by accident online. I called Michaela. And oh my gosh, changed my life. Got to meet Dr. Ferrell and Dr. Hyman. We did a 30-minute appointment with Dr. Hyman and went from not knowing what I was going to do, have no hope at all except for future of pain, and went from that to being right here today. I'm so excited and really nervous, but with the knowledge of knowing that I have something other than years of pain, I have a chance to put all that behind me and all this for through the VIP program is just awesome. It's like a dream come true. I was like, it's unbelievable. So glad to be here, and thank you, Michaela. Thank you, Dr. Hyman, Dr. Ferrell. Appreciate everybody. ROSM, is it ROSM? Orthopedics. Appreciate all these guys.
Yeah, so a little bit more about the microfragmented adipose treatment. So this has level 1 evidence. These are peer-reviewed, published research papers to show that it's beneficial in knee osteoarthritis. Also has evidence to show that it's beneficial with rotator cuff tears. It's also been used in Achilles tendon. It's been used for meniscal tears. So we have research on all of these things. There's over 100 peer-reviewed, published studies that are out there. We're continuing to work with the company in order to push and publish this research forward. So we're doing research with the company on knee osteoarthritis as well as on partial thickness rotator cuff tears. So these are new cutting edge techniques that are really kind of pushing the envelope, trying to find minimally invasive ways to keep people functional and keep people active. There's a lot of people that are in what we call the treatment gap. So this is when they start to have chronic pain but aren't quite ready for surgery. And so this is a perfect option that's minimally invasive to help those people that are in that treatment gap to have less pain, better range of motion, and better function. right, so we just finished up with our microfragmented adipose treatment to the shoulder for chronic shoulder pain. So this is a procedure where we took the fat out of his glutes. We were able to put it into all the areas that he had pathology. We were able to get it into the exact area that we wanted to using our musculoskeletal ultrasound. It allowed us to see the area of pathology and make sure that the needle got directly into that area. So this is going to really optimize our healing and allow things to get better. So he's going to be in a sling for the next 7 days. After 7 days, he's going to come out of the sling, start working on gentle range of motion. I'm going to have him start physical therapy at 2 weeks. At 2 weeks, physical therapy is going to work on strengthening the muscles in around the area, making sure that the shoulder is getting stronger, range of motion is improving. And I usually like to see them back at 6 weeks. At 6 weeks, we're going to reassess range of motion, strength, function, monitor his pain, make sure the pain is improving. Sometimes we may need to do a booster injection, sometimes we may not. As he's going to continue to progress, we expect to see about a 50% improvement around the 6 week mark. When I see him back at 3 months, I'm hoping to see somewhere around 80% improvement, and he's going to max out his improvement somewhere around 6 months down the road. After 6 weeks, I think we're going to be able to get him back into doing, more physical activity. And, when you have a demanding job that requires you to lift and move, I think we can do that safely at that point in time. So once again, we did microfragmented adipose treatment for chronic shoulder pain. This will allow him to get back without having to have a shoulder replacement. We usually find that these benefits will last for about 3 to 5 years before we have to do another kind of repeat treatment. You can find us at ROSM.org. And so on our website, there's a contact page. You put your information in, we'll get right back to you. On our website, you can also see all of our different locations. We have 6 locations in the Washington, D.C. area. You can also see information about the procedures that we offer on our website too. So if you have any questions, give us a call or reach us on the website, rosm.org. Thank you.